Hi and Assalamualaikum. My name is Nurul Arina binti Barang Hisham and I'm from class SR243B. So today me and my group members will present about mechanisms of injury, technique of strapping and ankle sprain. So let's get started. So there are three types of injury, which is ankle sprain, high ankle sprain and also Achilles tendon injury. Next, we are going to talk about ankle sprain. As you know, ankle is one of the most complex and heavily used joint in the entire body. So a sprained ankle is the stretching or tearing of ankle ligaments, which support the joint by connecting bones to each other. A sprain occurs when your ankle is forced to move out of its normal position, which can cause one or more of the ankle's ligaments to stretch, partially tear or tear completely. Next is causes of the injuries of the ankle sprain. Causes of the injury include a fall that causes your ankle to twist. Number 2, landing awkwardly on your foot after jumping. Then walking or exercising on an uneven surface. And lastly, another person stepping or landing on your foot during a sports activity. Furthermore, causes of the injuries are if there is a sudden twist or roll to the ankle, ligaments on the sides of the ankle can stretch or tear. Most ankle sprains occur when a sudden inward and downward movement of the foot stretches the ligaments on the outside of the ankle. For the signs and symptoms of the ankle sprain include pain, especially when you bear weight on the affected foot, tenderness when you touch the ankle, swelling, bruising, restricted range of motion, instability in the ankle, and also popping sensation or sound at the time of the injury. The common sports that causes ankle sprain such as football, volleyball, tennis, and also basketball. Next, we move to the injury grade of ankle sprain. As you can see on the diagram show that the grade 1 sprain is characterized by stretching of the anterior talofibular and calcaneofibular ligaments. In the grade 2 sprain, the anterior talofibular ligament tears partially and the calcaneofibular ligament stretches. The grade 3 sprain is characterized by rupture of the anterior talofibular and calcaneofibular ligaments, with partial tearing of the posterior talofibular and tibiofibular ligaments. Next, we are going to the anatomy of the ankle sprain. Anatomy of ankle sprain is usually that of an inversion type twist of the foot and followed by pain and swelling. The most commonly injured site is the lateral ankle complex, which is composed of the anterior talofibular, calcaneofibular, and also posterior talofibular ligaments. The ankle joint is a hinged synovial joint that is formed by the articulation of the talus, tibia, and also fibula bones. Furthermore, patients with peroneal tendon problems usually describe pain in outer joint of the ankle or just behind the lateral malleolus fractures. Peroneal tendinitis is inflammation in the tendons that run along your outer ankle bone and the side of your foot. These tough bands of tissue connect the muscles in your lower leg to the bones in your foot and they help stabilize and balance your foot and also the ankle, and also protecting them from the injuries. Wih, apa ni? Next, we're going to move to the equipment that we needed for strapping an ankle sprain. Actually, we use masking tape because we didn't find in our places. So, the actual tape that actually we have to use is strapping tape. But in the video, we substitute with the masking tape. So, let's watch the video. Hi and Assalamualaikum. So today we are going to do closed basket with tapping for ankle sprain. Firstly, by applying ankle strips up on the skin, 2 ankle strips, and followed by doing the ankle strips down the base of the foot. Don't be too tight because we don't want to cut off any circulation, and follow with a succession of horizontal strips, and complete the tapping with 1 or more heel lock strips on the medial and also the lateral sides. To prevent inversion sprains, apply the stirrup from the medial aspect of the leg and pull under the heel to the lateral aspect, and do the horseshoe strip from medial to the lateral aspect of the foot, and follow by another stirrup in a weaving fashion. I'm going to continue this process until you have applied 3 stirrups and cover up of the foot. Continue with the horseshoe pattern again. Make sure the tape is nice and secure, but make sure the athlete ankle is in 90 degrees of dorsiflexion, and continue to do a stirrup again until it covers the up of the foot. As you can see, I'm almost to cover up the ankle, but we are going to do it over again. Do the basic ankle strapping and do the horseshoe pattern from medial side to the lateral side. So we are going to do again like this, like in the beginning, and do the heel locks to secure it. And then completely enclose the leg with horizontal strips. Apply the heel locks to the medial and lateral aspects of the ankle. Do it over again and again until it fully covered. The heel locks actually we apply it in a figure 8 pattern, and apply the lateral heel lock by pulling it an upward direction, and the medial heel lock by pulling in a downward direction. So as you can see, I'm going to continue my work to wrap it, just like in the beginning, from medial to the lateral, and also the horseshoe pattern. So make sure the tape is nice and secure. Lastly, we are going to apply the ankle strips up on the skin and also base down of the foot. Just applying one time because we don't want to be too tight, and we are all set. As you can see, this is the closed basket with tapping. Thank you.
Next, I'm going to tell you about one type of ankle sprain injury, which is high ankle sprain, or medically known as a syndesmotic ankle injury. This injury is worse than the common ankle sprain, the syndesmotic located above the ankle. The injury usually occurs when the foot or ankle is forcefully rotated outward, that pushing the fibula away from the tibia. It usually happens in contact sports such as football, handball, basketball, hockey, and wrestling. We move to the difference between low and high ankle sprain. A low or common ankle sprain occurs where the ligaments that connecting the fibula to the foot is being stretched or torn. This injury happens when you roll over on your ankle. This recovery period is between 4 to 6 weeks. While a high ankle sprain is a more severe type of ankle sprain because it may take between 2 to 6 months to recover. Next, the sign and symptom of a high ankle sprain. It is more or less the same as common ankle sprain. Just the pain and swelling will be located slightly higher on the ankle. A person with high ankle sprain may experience this kind of symptom. Firstly, pain. This is because the tissue around the injury place release the chemicals that stimulate the pain receptors. Second, swelling. It occurs at the site of the injury due to internal bleeding. It occurs because more blood is being pumped to the area to aid healing. Third, warm. The skin around the injured ankle is warm to touch as the body tries to heat the area to kill potential bacteria that may cause infection. Fourth, redness. The skin that covering the ankle becomes pinkish red in color. This is evidence of increased blood supply to the area. A high ankle sprain are divided into 3 different categories, which is grade 1, 2, and 3 according to the severity of the injury. Recovery time will depend on this grade. Grade 1 is the mildest type of ligament injury, as the syndesmosis is usually only stretched or slightly torn. Symptoms of a grade 1 injury may include swelling, tenderness, and stiffness. Even though the ligament is injured, walking is still possible. Grade 2 occurs when the syndesmosis ligament is partially torn. The ankle is still somewhat stable, but walking may be painful. There is tenderness, bruising, and swelling around the ankle. Lastly, grade 3. It occurs when the syndesmosis ligament is completely torn. The ankle is no longer stable and feels wobbly. Walking is impossible or very difficult and may be accompanied by intense pain. Knowing how to properly tape a high ankle sprain is very important. This is because if you do it correctly, it can help in decreasing pain and swelling. It also can help in reducing the recovery period. So, this is a video of me performing strap a high ankle sprain. I use kidney technique, which is closed basket weave. It is important to make sure the foot in dorsiflexion. Firstly, place the first ankle on the top, followed by the second ankle, just to make sure there is no gaps or anything in the back. Next, place the third ankle down to the base of the foot. It needs to be very loose because when she steps down, we don't want to cut off any circulation. Start the strapping from the medial side and pull the ankle to the lateral side. And then the horseshoe taping, I'm going to go down toward the foot, apply it on the medial side and wrap it around to the lateral side. And I'm going to repeat that. Apply from medial side to the lateral side and secure that. Repeat the horseshoe from the medial to lateral side. Do it again for the last time. Nice and tight. the horseshoe from the middle to the lateral side. Next, this is what we call closed basket weave. I'm going to continue wrapping this all the way up because we want it tight and secure as possible we can. Move to the previous basic ankle tapping. I'm gonna do 6. I'm going to start on the middle side and tear that, followed by the lateral side and secure it. I'm going to do heel locks, the basic ankle tapping. Repeat again from the middle to the lateral side. This is the last modification of the closed basket weave from the distal to the proximal. Start tapping from the bottom of the foot. Repeat it to the ankle till we get to the very top. The finishing, I'm going to place the ankle again down around the foot. And we are ready to go.
Okay, now I would like to continue this presentation to talk about Achilles tendon injury. The Achilles tendon is a tough band of fibrous tissue that connect the calf muscle to the heel bone, known as the calcaneus. The Achilles tendon also can be called a calcaneal tendon. It is the largest, strongest, and the biggest tendon in our body. The Achilles average about 15 cm in length and can be up to 26 cm in some people. The gastrocnemius and soleus muscle unite into one band of tissue, which become the Achilles tendon at the lower end of the calf. The Achilles tendon then insert into the calcaneus. Small sacs of fluid called bursal cushion the Achilles tendon at the heel. When the calf muscle flex, the Achilles tendon pulls on the heel. Then this movement allows us to stand on our toes when walking, running, or jumping. Despite its strength, the Achilles tendon is also vulnerable to injury due to its limited blood supply and the high tension placed on it. Moving on to the next slide, which shows there are many types of injury that can happen to our Achilles tendon. For example, in the second picture, shows that Achilles tendonitis, which is an overuse injury of the Achilles tendon. The next picture is an Achilles tendon rupture, which is a complete or partial tear that can happen when the tendon is stretched beyond its capacity. And for the last picture is a Hackland deformity, which is an abnormality of the bone and soft tissue in the foot. The soft tissue near the Achilles tendon becomes irritated when the bony enlargement rubs against the shoes. This often leads to painful bursitis, which is an inflammation of the bursa. Achilles tendon injuries are common in people who do things where they quickly speed up, slow down, or pivot. In running, gymnastics, dance, football, soccer, baseball, basketball, tennis, and also volleyball. These injuries tend to happen when we start moving suddenly as we push off and lift our feet rather than when we land. For instance, a sprinter might get one at the start of the race as they switch off the starting block. The abrupt action can be too much for the tendon to handle. Men over 30 are especially prone to Achilles tendon injury. We can also injure our Achilles tendon if we stress it over and over with high impact activities. These are known as a repetitive stress injury. The most obvious sign is pain above our heel, especially when we stretch our ankle or stand on our toes. It may be mild and can get better or worse over time. If the tendon rupture, the pain is instant and severe. The area may also feel tender, swollen, and stiff. If our Achilles tendon tear, we may hear a snapping or popping noise when it happens.
We could have bruising and swelling too. We also may have a trouble pointing our toes and pushing off our toes when we take a step. A knot on the back of the leg or bruising over the tendon is a sign of tendon rupture, while swelling, tenderness, redness, or warmth is a sign of tendinitis, tendon bursitis, or Achilles peritonitis. And lastly, thickening of small bump is a sign of tendinosis. Hi, so now I am going to show you the easiest way to strap Achilles tendon. To strap an Achilles tendon, first of all, you can use under wrap before start strapping. It is optional. If you want, you can use it, or if you don't want, then that's okay. For the first step, starting at the back of the calf, make an anchor around the top of Achilles. Then, the second anchor at the foot. Other than under wrap, you can also use light fixed tape, which can help to protect the skin and help the tape stick as well. For the next step, do an X down the leg. Make sure got the victim's foot just in resting position with line prone, so that when they are standing up, the pull of the tape will take the load of the Achilles. Repeat the X step again. And lastly, I am anchoring that down at the top and another one at the bottom as a lock. And that's it.